If you can't hear me at any point, please let me know.
Will do.
Okay, well, thank you. We have a whole hour to talk about things that we care about. And I know that a lot of the things we care about are linked to dyslexia, you and I. So we're going to have a great conversation. I'm going to take the time to your profile because I think everyone who's joining needs to know who I'm talking with and why I'm so excited to talk with you. So don't be embarrassed. Just a minute, reel off your bio. Everyone who's here is a futuristic dyslexic thinker, who is a dynamic public health practitioner, passionate about health promotion, disease prevention, healthcare planning, and resource management. Her career spans over 23 years of experience working in the health and IT industries in several countries, including Nigeria, the United States, and Canada. She has spent over a decade in IT project management. She's a certified data privacy solution engineer. She has worked on various public health related projects in hospitals and across sectors in the US, with specific focus on data collection, data management research. She's a visionary, enthusiastic leader and pioneer. She pioneered Lagos State Breast Cancer Program and the e-health unit at the Lagos State Ministry of Health. Wow. Her work experience in government in the US, in Canada, and Nigeria gives her a balanced view of the health sectors. She's been a herbal medicine advocate that has projected her into herbs and agriculture. There's just so much that you have done, Dr. Ronke Agoro. Thank you so much for taking the time to join us today. I can't wait to hear from you and learn from you about your inspirational journey with dyslexia.
Thank you. Thank you very much.
So I know I reeled off your bio, but let's start by hearing from you. If you were going to introduce yourself, bio aside, how would you like us to remember you?
That's a very good question. I think futuristic speaks, sums it all up. I'm a visionary, futuristic. I've spent a bulk of my life in the future that I have in the present, and it took a while to actually understand what was going on. I'm a very enthusiastic person. It actually precedes me sometimes, but I think futuristic, dynamic thinker and would be the bulk of it for me, and I'm passionate about what I do. I can't hear you.
No!
Yes, I can hear you. You dipped a bit for a while.
I believe I'm connected to 3 options of internet. I'm really hoping you can hear me throughout this session.
I can hear you now. I can hear you now. I know what you mean.
Okay. Futuristic and dynamic. I think for many people, when they think about that, they actually don't understand what it means to feel that you are futuristic. So what does that mean to you, futuristic?
Let me tell you a bit about how I first realized that I was futuristic. I think I was in my teenage years, and I enjoyed reading, even though dyslexics tend to kind of swaffle around reading. And I always thought about the future, about 20 years right into the future. Then in recent times, I have a cousin who's a colleague as well, said that she'd always say that, okay, you're too way advanced in the future, you're too in the future, you're too in the future. And then it didn't really dawn on me. But there was a project I started with a group of friends about 14 years ago. And we were told then that we were 20 years ahead. And it was my baby. The project was my baby because it was something I'd written in school. And we're trying to bring it to life here in Lagos. And they said, one of the comments that we got back was that we were 20 years ahead. It didn't really resonate deeply for me to actually take ownership of it. But when I switched from pre-med to public health, I now actually understood what that meant to be futuristic. The beauty of public health is that you actually have to solve problems 20 years, 30, 50 years ahead before it actually comes to bite in the present. And it fits me like a glove. It's like me playing in my domain. So I actually remember when the shift happened, where I was really plugged into what was a natural environment for me. So it's not something that I knew bits and pieces of it, but in recent times, I've taken full ownership of it and actually realized that it's not something that I can shake off. Pardon?
You.
Say that again. I'm sorry, I lost you there.
You cannot shake it off because it is you.
Yes, yes, it is, and I'm so proud of it, like I've never been.
Okay, so I know that not many people can firmly say that they are futuristic, and I have a feeling that that has something to do with dyslexia. So let's go to your dyslexia story. When did you realize that you were dyslexic?
That's a good question. I think bits and pieces started falling into place in more recent time than before, but I actually took a grip on it when I was on a radio show with a friend a few years ago, and it was actually something to do with another form of disability, and it actually dawned on me how my journey actually came to be. You know, like I said, in bits and pieces and all that. First and foremost, I'm hearing impaired. About 20, 30 years ago, I used to wear an hearing aid and all that good stuff. And when I wore an hearing aid, I was, if you are old enough to know what this series was called back in the 80s, Bionic Woman. Bionic Woman was a woman that had like some sort of supernatural power that she could hear what was happening the next door and all that. So literally I was that, because I was wearing an hearing aid, and I could hear noise from the two doors down. And yeah, I literally could when I started wearing an hearing aid, because it was so sensitive. It was really amplified, so I could pick up a pin drop literally. And I think in the years that I believe in the years that I wore an hearing aid, it kind of rewired my brain. And looking back now, I used to be teased in school. I was called a calendar. And I didn't really understand why because I could tell you dates, and you know, it was very unique. I could tell you dates, time. If you said I did something, I'd ask you what was I wearing, where was I, and all that good stuff. So nobody knew what that was. I mean, the world was different 30 years ago in comparison to what it is now, 35 years ago. And now they just thought, you know, I just couldn't hear. But it gave me, it was supposed to cure or help with a problem, but it created other problems for me.
Oh.
Pardon? Yeah, it did. Because nobody told me, the audiologists and everybody in that field, the ENT specialists, they didn't tell me what the side effects of wearing an hearing aid, because I didn't want one for the best part of my life at that point in time. And then you're giving me something to supposedly help me, but nobody told me how to deal with it. So I was, you know, like hearing a lot of noise. It affected my concentration a lot more than it should, because I could hear everything. And I remember very vividly, occasionally I'll turn it off just because there was so much activity going on in my head. Yeah, so nobody told me that this was going to be the side effects and all that. And towards the early part of in the 90s, I can't remember when exactly now, I just stopped wearing it because it brought more confusion than I needed to have at that point in time. One thing that I would say that I didn't know the word was dyslexia, was when I had to take JAM. JAM is Joint Matriculation, the exam that is equivalent to, what's it called now? what's this exam called? I can't hear you.
Relations board.
Thank you. So I took that particular exam 6 times.
Wow, 6 times.
Yes.
Yes, that's one every year.
Pretty much, yeah.
Wow.
In fact, there was a year that it happened twice, and I was present at both times. Now, the funny thing was that I was teaching other people how to pass the exam, but I couldn't pass it. Fortunately, fortunately for me, my mom, bless her, she never gave me any word, any discouraging word that I can remember. She'd always say, you know what, just try again. You know, she was always the one, to be very honest, who bought the forms for me and asked me to fill it. So she was very relentless in that regard, and she would say, fill it and all that. And I'll get into the exam. I would have studied to the best of my ability and all that. But the results would come out and it did not even correlate with my effort or what I thought I had done. And of course, as a teenager then, and nobody to tell you what exactly was going on, it led into so many things, to few things that I can remember vividly. Ulcer, dementia, and insomnia. Because I had prepared for an exam, and I remember one year, I think it was in 1992, I'd studied so much I couldn't switch off my brain. So, like I said, bits and pieces started falling into place, but you know, science wasn't as advanced as it is right now to help me come to terms with what it is right now. So I think me owning dyslexia actually happened maybe in the last 10 years or less.
I mean, that was a huge chunk of time. And it really sounds like that period, as supportive as your mom was, there was a lot that was difficult for you to cope with the dyslexia at that time that you probably didn't even know was the dyslexia. What was it about the way the exams were that made it difficult for you to communicate what you knew? Because clearly you knew what they were asking.
Yeah. So while I was here in Nigeria, I even up till date, I must confess, I, as a dyslexic, I see things in different shades of gray. Multiple choice questions are black and white, or sorry, black or white. It's not a shade of gray. So in taking the exams, I'll be like, oh, it could be A, truly it could, well, B too could be, because I can see it from that dimension. All the answers look right. So I remember recently I was like, because exams have a specific way they want questions answered. That was what I wasn't getting. But if you took it to the broader spectrum of answer the questions open-ended, I was fine. But A, B, C, to me, all the answers looked right. And that was the struggle. And even till date, I still will not willingly sit down to do an exam that is multiple choice, because without being arrogant, the way examiners look at questions or put questions together, my intelligence is higher than that. So I have a struggle. I'm struggling to fit into a box, but naturally, the box was never meant for me. So I'm trying to confine myself, or any dyslexic is trying to confine themselves into a box, and it's not, it never will fit.
Wow, a lot that you've said in there. First of all, that box, I think many of us don't realize how much we live with the box, because school itself is often a box, even though school is supposed to help you figure out what shape you. School chooses a box and forces you into that box. But I think what is very inspiring for me about you and your story is that you've gone on to all of these achievements despite what happened in that period. And for me, it's a way that you have overcome fear, you know, whether it's fear of failure, fear of ridicule, fear of repetition, fear of whatever it is, disappointing other people, and coming to a sense of freedom of yourself, freedom to allow yourself to be and to thrive. How have you, how would you say you have made that transition from fear to freedom?
That transition has been, it's a lifetime's journey. So for me, I know that my brain is always in the future. And I know that truly, if I focus, calm down, and I know how to study or how to get on something, I can excel. Over the years, especially taking jams 6 times, trust me, it gave me a deep level of resilience, persistence, perseverance that I don't think I would have gotten had it been as easy as ABC for me. So with that, I had this inbuilt attitude that, okay, there has to be a way around it. I don't know what the answer is, but there has to be a way around it. And it's not, I've come to embrace wholeheartedly that there's more than one way to get to where you're going. One, there's more than one way to get to do what you want to do. There's more than one way to skin a cat. And there's a Yoruba proverb that says that there are many doors or entrance into a market. And those were things that my mom used, even though she did not understand that I had dyslexia. Those were little ingredients, that I should say, that she put into the spice of my life to get me to where I am now. And every now and then, when I do face one challenge or the other, I'm like, okay, we just have to put on a different thinking cap and find a way around it. It's given me the attitude and the zeal to never give up. Not because I know the answer, but then again, it's not a one-size-fits-all. So I found myself, number one, I'm a non-conformist in any form, shape, or manner. I found myself challenging that. Says who? Even because I say I'm a scientist by and large, but I'm like, science is not definitive. It's not an end game, because there's a lot science doesn't know, and science is still discovering a lot. Science has found 1 million things. There's still another 10 billion things science does not know. So I'm like, says who? So over the years, that has given me the confidence to actually challenge that, that who says? And it has helped because I've had that opportunity to actually educate other people that, look, what you're looking at is not, it's simple, but at the same time, it's not as simple. So you should not have that automatic disposition to condemn someone that, oh, this person doesn't know anything. Because trust me, I did in my elementary years in school, I did woefully in school, because back then schools, students were judged by positions in classes. And I can say gladly and proudly, I was 52nd out of 55, 53rd out of 55, and all that good stuff. But one thing everybody could tell you then was that I was smart and intelligent. School is just a fraction of who you are. So, and I had a very good memory, even from a very, very young age. I remember we had to go to one of my uncle's place, and everybody didn't know how to get there. I had been there once, and I led them to the place. So there were things we just didn't know what or how to harness it or to make use of it. So it's a lifetime journey that you just have to keep owning as you go along.
Absolutely. Thank you for that. You know, there were a few things you said there that I would like us to talk about. Can you still hear me?
Yes, I can hear you.
So you mentioned that going through that gave you the resilience, perseverance, and persistence that you find very useful to you nowadays. And I think a lot of people also think that the struggles that individuals with dyslexia go through eventually works out, yeah, at least you became resilient, But do you think that there are other ways that we could build those skill sets without taking people through that struggle?
I think, yes, I do. One definite way is to keep advocating and raising awareness about it. because I remember, I think at the first Dyslexia Nigeria conference about 4 years ago, and I told my boss that I was going for dyslexia conference, and was like, what are you going to do there? I'm like, oh, I'm dyslexic. He was like, oh, you don't look it. I'm like, oh, wow, thank you. I'm not supposed to look it because it's not a look. A lot of people are dyslexic, and WHO has proven this in their report. I think it's 1 out of 5 or 1 out of 10 people in the world are dyslexic. If you 1 out of 5. So if you go by the current population of the world at 8 billion, that's 1.6 billion people. That's a lot. And 1.6 billion people are dyslexic. So it's not a micro percentage that you can just disregard. I was speaking to one of my daughter's teacher earlier this morning at PTC, Parents Teacher Conference, because I have 2 children who are dyslexic. And I was telling, because you were saying that, oh, that my daughter can be unserious sometimes. She's restless, she's playful and all that. And I let him finish. I'm like, yeah, I know, that's definitely her. And I said, have you heard of dyslexia? And he was like, yeah, and, you know, you hear words, but you don't really understand the concept of it. So I asked him that, and he was like, you know, there was a bit of a blank look on him. And I was like, she's dyslexic. That's why you can't get her to sit still in that sense and all that. You have to teach her in a way she can relate to. Otherwise, she's not going to grasp it. So I said, I'm dyslexic. And of course, before they start looking at you like, oh, you're another condemned person, I quickly pulled it out. And I have a PhD in public health. Ah, okay. Pardon?
You're at the top of academia.
Yes. So I tend to have to do that when I say, oh, I'm dyslexic. And they're like, ah, you can almost see the condemning look coming on. I'm like, oh yeah, I'm dyslexic, but I have a PhD and all that. So don't look at me in that sense. I'm like, oh wow, and all that. And as I've spoken to people over the last 4 or 5 years that I've actually chosen to be an advocate for dyslexia, I've met people that actually realize that they are dyslexic, but they didn't know they are dyslexic. And that has made a huge difference, that I'm like, oh, welcome to the club. They didn't know that was what was wrong with them or what they needed to embrace. I said, look, it's not a disease that you can wish away. It's something you have to learn to live with for the rest of your life. And they're like, oh, so that was why I had their struggle in school. I'm like, yeah. And, you know, more people, even in professional lives, I'm not talking about students who are still in school now. I'm talking about professionals like you and me that are like, oh, and then the big bright light comes on. Oh, so that's what he was. So that's what I was, and all that good stuff. So it's not something that a lot of people know. People are getting more and more familiar with it, but not in depth. So there's a huge need to actually increase awareness. And then perhaps parents and teachers will be able to identify it, and bosses too will be able to identify it in the classroom, in schools, and at workplace. Because I've heard people refer to other colleagues, or that person is so, in quotation, D-U-M-B, I don't want to say the word, but the person is struggling because you're asking someone that doesn't like numbers to actually be an accountant. You know, it's a mismatch. Round pegs and square holes. Yeah.
And in a mismatch is also it's a shame, it's a loss, because there's stress that person has that you're also not utilizing. So beyond being in the wrong one, you're actually losing what they're quite good at. But I mean,
exactly.
Much that you've just said now about the awareness, and the awareness levels, the awareness on the school level, the awareness on the parent level. For you,
yeah.
with dyslexia, you are their #1 advocate. And I think sometimes parents and guardians forget how much power they have to shape a child's story or the backdrop with which they build their own story. So what would you are some of the guidelines or advice that you would give parents as to how to take something that can be made to be so difficult and negative to be something that can be seen as so beautiful?
Fantastic question. One thing I would say, one thing I've experienced personally is that I would love to say in Nigeria, but that would be very untrue. Across the world, because I've had to deal with teachers in Canada, teachers in the US, in England, and yeah. People throw words around in terms of label.
Yes, that's
I
right.
give you a good example. About 10, 11 years ago, my son's teacher, I think it was in grade 1 or, yeah, said that he couldn't read and asked to see me. So I went to see her. I said, "What do you mean he can't read?" And she said, "He can't read." I'm like, "You need to explain better. What do you mean by that? Is it that he can't read CAT? Is it what exactly do you read?" And she was like, "Oh, he just can't read." I said, "Well, okay." So in fact, I was very calm that day. I said, "Look, Barack Obama was the president at that point in time." And I said, "I'm more educated than Barack Obama in terms of degrees, but Barack Obama probably reads better than me. They're two different things. What exactly can't he read?" So I realized then that she just threw the word out there without actually being able to synthesize what she had said. And even today, when the teacher said that my daughter was unserious or she needed to buckle up on being serious, I realized that the gap of him not knowing was giving him the confidence or effrontery to use a label, whether he understood the label or not. And it's a common practice. We just throw out a label that a child is dumb, da da da, and all that good stuff. But what exactly is the child not good at? So to parents, you cannot let anybody label your child without a very good reason. You have to be convinced beyond reasonable doubt for anybody to attach a label to your child. You can't let somebody say, "Oh, your child is dumb." Under what classification, under what auspice is that person saying the child or someone is dumb? It has to be, I mean, I don't think I've met someone that is dumb all round. I think anybody that fits into that category will be someone who doesn't have a brain. Then we automatically know that that person won't be alive anyway.
Yes.
So I say that, "Oh, this person," we all have strengths. I have my strengths, and I'll tell you gladly, there's some things I don't want to do. Not that I can't do it, but it's just going to take too much manpower from brain power. And parents have to be the voice of their children because they don't know what they're going through. And getting them to speak with someone that has been through what they're going through helps them. Like my daughter yesterday, she didn't do so well in a test and all that, and she cried and cried, and she was like, "Oh, mommy, I really tried." I said, "I know." And I always tell my children's tutors or teachers or whatever they're called that I am not interested in grades. In fact, I remember about 8 years ago when I took my son to England, I told the headmaster, I said, "If my son ever comes home with straight A's, I'll pull him out of your school." And he was like, "He's never heard that before." And he said, "He's never heard that before." I said, "Yeah, I know." He said, "Most parents want their children to get all A's." I said, "For me and my son, if he comes home with all A's, it's an indication that something is wrong with him. Because his strength is not a flat line. So if he comes home with an all A's, it's either someone is doctoring that report, something is definitely wrong with him." So like I tell anybody in the health sector that, look, as a patient in the health domain now, you have to know your body better than a medical doctor. The medical doctor knows the human body, but not your body.
Yours.
Exactly. A parent knows their child by and large, at least 90%. You cannot let the 10% or the 5% that the teacher or the school know be heavier than, pardon?
Can't carry more weight than the 90% that you know.
Thank you. So when I tell my children all the time, I say, look, all I want to know is that you're putting in your best effort, you're learning, you're improving. I don't care about grades, and I never will. I am not easily swayed or in awe of somebody who has a parallel or has a GPA of 4/4. It doesn't mean anything to me, because education for me is not certificate. It's not a degree. Education is learning continuously all throughout your life. And you have to be able to apply it and critically think, solve problems, because you can be as educated as they come and actually be, you can be, and almost be not so intelligent at the same time. So I want you to be practical about what you're learning and being able to use it in life, because school will end. It's not indefinite. School has a phase and it will come to an end at some point, you know, and that is why I really tell any parent that take a good look at your child. Your child has some strength, focus on that instead of what they're not doing so well in school. School is not a true measure of a child's intelligence. And fortunately for me, I experienced that as a child, and so do I see that in my children, because they're very intelligent. School is a different kettle of fish.
I mean, even the comments, everyone is agreeing with what you're saying. You know, absolutely, school is not indefinite. School will end. It's just a box. There's so much more than just the reading and writing. And, you know, like, school is not a true measure of a child's intelligence. I know you talk about the labeling, you know, don't let someone else label your child unless it's absolutely necessary. And I wanted to add that even when that happens, the labeling should be because they're now going to be able to identify what is going on so they can support, not just for labeling's sake, ever. It should never be labeling for labeling's sake, no matter what.
Yep.
I think for me, it comes back to that conversation on fear. I think a lot of schools, even in our experience engaging schools, it's the fear that parents will see them as incompetent in dealing with what is in their classroom. So they would rather call it something that is out of their control, in quote. Oh, the person is DMB, like you said. That has nothing to do with me and my teaching. But it's really a fear. Who worked in public health, also worked with a lot of institutions. What do you think is the best way to address that fear that an institution can be nullified or made irrelevant if they, you know, they feel that they admit to something that they're still learning about?
That's a very good question. I don't think there's any definitive way to intercept or as a form of intervention for that. I believe without a doubt in my mind that it stems from leadership. If the leadership or management of an entity, company, government, or whatever, embraces something and said, okay, I mean, take for example, Piers Branson, who owns Virgin Atlantic, is dyslexic. So it gives the confidence to other people to actually step forward and say that, oh, okay, maybe this person being dyslexic, you know, it's not a bad thing. Or, you know, if this person can do it, it gives inspiration to other people that, okay, I can do it as well. And when I facilitate at work and all that, I actually teach now at a tertiary institution here in Lagos. I tell students that it's not a creative journey. It's not a definite, it's not a bus stop, it's a journey. So you're going to actually learn, unlearn, and get wiser as time goes on. But throwing out the word dyslexia and all that, and you have a company, an entity, whatever, not understand it and not appreciate it, could delay the entire workforce or the immediate community of someone who's dyslexic from embracing it. If you have leadership saying that, look, because you're dyslexic doesn't mean you're dumb, because you're dyslexic doesn't mean you can't do this and all that. Like I said earlier, awareness and the absence of it speaks volume. That would definitely, you know, like right now, I'm too glad to wear. If I could, I'll put out a billboard all over the country. I'm dyslexic. Leadership and awareness, having people speak more about it, you know, taking it forward to say that it's not the end. It doesn't mean the person is disabled in the real word of it. It just means they have a different brain from what every other person knows. So that advocacy and leadership, I think they go hand in hand without discrimination. That is the only way where, because if leadership or management doesn't embrace it, it automatically, in my opinion, gives every other person around the opportunity to be lazy or just to stigmatize people. But if they see leadership and with advocacy and awareness, they're like, oh, okay. In fact, more likely than not, you'll find out that certain issues will be referred to someone that can handle it instead of just assuming everybody can handle it.
Absolutely. And I think, you know, when you talk about the awareness, the leadership, the advocate, those three pieces, they really indicate that organizations themselves are living things, because organizations are made up of humans who are living things. And like you said, the point is continuous learning. So not an organization, a school, a company made up of people to improve what they know over time so that they can be better. I absolutely agree with you on that. Leadership, awareness.
Yeah. Yeah.
I think we talked about fear from the perspective of the individual, which was you, and from the institutions. How about from the perspective of a parent? You know, sometimes the truth is many parents also don't know what milestones their children should be hitting. And they truly get nervous or anxious or worried that they're not doing as well as they should, you know, and where should they focus on? And they ask, what should I be doing instead of how should I be? I think you've demonstrated that yourself, you know, with your children is how you are with them rather than, oh, what should I be doing next? And that in how you eventually find what to do. So how would you say parents should be? How should we be?
How should we be? We should be as curious as they come, I think. In talking to my daughter yesterday, she used the word, even though I've heard it so many times in life and I've used it myself. I was explaining to her, I just asked her a question that, do you spend a lot of time in the future? She said, yes, I zone out a lot. Now, it actually brought a phase in my life back to reality for me. Unless you are asked, unless you take a good look, you know, sometimes we get, as parents, as a parent, we get lost in what everybody should be doing, you know. Everybody's going to year 9, everybody's going to year 10, everybody's starting university today, da 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 da. We can't get lost in there. But going back to what my mom said when I had to take a class again, which was Form 4, I think that's year 10, I think. And I had to take it again. I had to, and I wanted to do medicine. And that school, that report card for that year would have made me a very, not a good doctor. I would say I've even made it. My aunt, bless her soul, she said, she looked at the result and said that I should take the class, the entire school year again. And I was like, oh, I was just getting popular, da 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 da. I was just getting out of my shy shell and all that. But my mom said something that has stuck with me for almost 40 years or thereabout. She said, do not use someone else's journey. It's a Yoruba proverb. Mawa Galago, she was like, do not use someone else's journey to determine your journey because you're not on the same path. I didn't understand it deeply, but you know, it was a pep talk, and she woke me up in the middle of the night to give me that pep talk. But over the course of time, I've come to actually realize that it makes a lot of sense. So, like we said earlier, 1.6 billion people are dyslexic in the world. The mainstream is the remaining 6.4. Yeah. So everybody's looking at 6.4 billion people. I'm forgetting that 1.6 billion people is a journey by itself. There's what, 20 students in a class. Maybe 5 will be dyslexic, give or take, or 4. And then you're looking at it that, oh, it's just my child. But you haven't gone to find out, maybe there are 4 other people. You only see your child, which is fair. But you have to look at it in a holistic manner. That if she's struggling and everybody else, even the teacher said it today that, oh, my daughter is around everybody that is intelligent and all that. They're academically intelligent. There's a difference. Academically intelligent and intelligent on a normal spectrum, they're 2 different things. Except your child can't speak, can't hear, blind, all of that at the same time. Would you say that, oh, there's something wrong? As a parent, you have to find out what exactly your child is good at. My 2 children that are dyslexic, they both had one sport in common, football. My daughter actually plays for her school and all that good stuff. Football, it lights up the light in her eyes. So I'm like, okay, there's so many things that you can do in the field of football when you decide to go to college and all that. The world has changed so much in the last 30, 40 years, where our parents said you had to be a lawyer, engineer, doctor, architect, those mainframe degrees. Each of these degrees have been broken down into nothing less than 10 different degrees. So you might want your child to be a doctor. Here I am. There's more than one way to have the title if that's what you're interested in. There's a child that wants to be an architect and you want your child to be an architect. Well, there's interior architecture now, which is probably not as comprehensive or whatever. You know, there's so many ways. So we need to, as parents, need to stop trying to live our lives in our children's space. If we don't refrain from that, you're going to be exerting a lot of pressure on them that is going to invariably make them think they're incompetent, they're not good enough, lack self-esteem, lack self-confidence, and all that good stuff. And it can be a time bomb waiting to happen. Like I said, everybody on the face of the earth, they have their strengths, and their weaknesses. You have to help them to be able to light that path, for them to actually be able to own it. You know, to say that, okay, this is what I'm good at, this is what I'm not good at. There's some things you can't pay me all the money in the world to embrace. I'm not interested. It's not, I can do it if I want to, but it's just not worth my while because it's probably going to take a lot of energy from me. So I'm not going to exert it that way. So parents need to step back from the mainstream and say, oh, everybody's going to university, my child. Aye, step back and look at your child as your child and not just a number of 20 students going to universities. That way you'll be able to actually guide your child, because you might have even gone through the same path, but you've forgotten, or you just, you know, didn't realize it. So I think that's the main thing, stepping back and looking at your child up close and personal. I can hear you now.
Can you hear me? Can you hear me?
I can hear you now. I can hear you now.
I'm going to go back and watch this, our conversation again and again, because I feel and I know there's so many things you've said in here that are little nuggets that can chart the way for so many people. And like you said, my favorite one, light the path for them to own it. I think Dr. Agoro also added in the comments that just know that every child is like a keyhole Find the right and it will always open. And that is
Yes.
absolutely true. It's the same thing you've also said. There is
Mm-hmm.
no any child. We all have our strengths and our challenges, and we should build on those, and we should appreciate them and appreciate ourselves for who we are and what
Yeah.
we do. Thank you very much for that. I know we're rounding up to 10 minutes to the hour. I'm going to ask you a question, and then I'm going to leave it to you to add anything else that you would like to add, maybe from the future as well, that I haven't even asked you, because I don't see questions from the future. So I wanted to, is there anything you experience now in your daily life that you struggle with because of your dyslexia?
That is such a practical question. Lord have mercy. Yeah, like I said, it doesn't go away because you're older. Classic example, about 2 weeks ago, there was a service of song for like a big sister who passed on, bless her soul. And the flyer was sent. And it read something, let's say number X, Water Corporation Drive.
Okay.
And I was on my way, and something just said, look at it again, you know. Guess what?
What?
The address actually read what I saw before I went back to it to realize X number Water Corporation was Walter Carrington.
Oh, wow.
So, like I was explaining to my daughter, the brain of the 6.4 billion people on the face of the earth, just for analogy's sake, runs at, let's say, 100 per hour. I, as a dyslexic, my brain runs at 1,000,000 per hour. So I was reading so far ahead that I have to bring myself back to the present, otherwise I would have. And it happens all the time. In fact, another classical case this morning, I asked for someone's phone number, and my sister sent it, and she sent a screenshot instead of sending it as a contact. And I was like, oh my God. I kept trying to memorize the number to put it. I must have gotten Emefele's number and everybody else. I sent her a message. Why did you do that? So she replied and said, oh, she realized that my dyslexia was a play. I said, yes, it was. Because what it was that, what it is that when you're looking at certain numbers, unconsciously, and it takes a little bit of understanding and maturity and experience to be able to retract it and trick it and tune it back to your present status. My mind was multiplying a lot of numbers at the same time and all that. And every time I was reading numbers, it was like that bionic woman essence. I was reading numbers from maybe 2 doors away. It was so difficult. One thing I like about myself being dyslexic is that, honestly, I don't know how to do mundane tasks. A classic example, about 3 years ago, there's a way they name number files. It's something I've never done before that I can remember. And just to label a file, they had to get a junior staff to teach me. I'm like, I can't do it. I could not process it in my beautiful brain. It was actually more challenging than the PhD. I was like, I can't do this. And I realized that it was so mundane, I couldn't do it. So I'm like, okay, here is where my strength lies. Give me a task that requires moving Abuja to Lagos. I'll be excited and challenged to do it. But if you're asking me to do the simplest thing, to move a phone from A to B and it's right in front of me, I can't do it. So it still happens live, you know, and it takes the grace of God to be able to overcome it. And so, like I said, it's not something you can shake off and you're done with it. It's something you have to learn. And I don't think it's something you can necessarily teach, because we all have to develop the tools ourselves, but you can get inspired by hearing someone else talk about it.
That's true. Like, I know people have been inspired by hearing you talk about it today. And there's something I love about the way you describe the challenges, is that you still describe the challenges as positives. I think that's very difficult for people to do, you know, to still see that this is me, this is still my strength. It just plays out in a way that you're not used to. So thank you very much. Perspective. Someone asked a question. How easy was it for you to study your master's and PhD?
Oh, that I like. It was actually a lot easier than JAMB. I can do, if you're dyslexic, you can, without a doubt in my mind, I can do 59 PhDs instead of taking JAMB, because dyslexics can see logic. Once you have the foundation, you know what's logical. There's a pattern to it. So, and PhD actually is not about intelligence. I tell people that. It's actually about perseverance, persistence, resilience. It's not about intelligence to a large extent. I mean, yes, you do have to have a grain of it or whatever, because in my class, 100 people that started the PhD program. The year I graduated, less than 20 of us graduated because life happened. Coping skills were present and absent. So many things.
Right.
Dyslexics tend to want to be able to at least forge on, whether they're forging on right or wrong. Once they get a hang of it, that has been the case in my situation, that I'm like, okay, there's no right or wrong. So I always say this, and it probably gets on people's nerve, that it's neither right nor wrong. It's just different. I coined that phrase in Spain, in Madrid, 2008, during my PhD conference, that it's neither right nor wrong, it's just different. And I say this all the time, that unless you've met 1 million people in your lifetime, can you say this is not the norm? What do you mean by that? Because my norm is different from your norm. And therefore, there are droplets and pockets of norms all over the world. You just have to define your norm, and trust me, you'll find that it's not just you. So PhD is resilience. It's not, yes, it's more resilience, persistence, and being dogged, I guess, than being book smart. It gets easier. Pardon?
Intelligence. The logic is also intelligence.
Oh yeah, oh yeah, oh yeah. Yes, I may not book intelligence alone.
Yeah. Thank you so much, Dr. Agoro. It's been amazing speaking with you. There are lots of nuggets you've given us today. I can't remember them all, but you've told us about being flexible as parents, as individuals, as institutions, that education is a learning journey. School is your life. There's more than one way to skin a cat to get what you want, to achieve the goals that you want. If something is not working out, put on a different thinking cap. I really like that, because you didn't say if something is not working out, keep trying the same way over and over again. You said put on a different cap. And I think that applies in so many different ways. You've also talked about perspective, you know, that something is a perspective is different from ours doesn't make it wrong, and that there's no need to judge in that regard. If a child is going to in any way, it has to be because they're going to get some support from it. And you did talk about leadership, advocacy, and awareness. So many things I learned from you today. I would like to give us some nuggets for future before we go.
Well, like I said, the future is so bright. You're going to need a couple of glasses to actually shade your eyes from it. The world is changing. Change is the only thing that is guaranteed. The future, the children truly are the future, because there's some problems that we don't have the skills to solve. Not that we can't learn, but they're learning it faster than we are, or we could. So it's changing. Technology definitely is taking the forefront. Good or bad. I think in every situation there's a good, there's a bad, and not so pretty, so to say. So the future in the health space is definitely dynamic. So many things are going to be so many problems are actually going to be solved by dyslexics. Like I was talking to a neurosurgeon about 4 years ago, and I said in the next few years, surgeons will be able to actually operate remotely. It's being worked on right now as we speak. So the future is bright, and if you have a child that is dyslexic, you have a solution right in front of you. You just need to help them path.
Way to conclude. Thank you so much for your time. For everyone that has us, thank you for being part of this conversation. I hope you learned as much as I did from Dr. Ronke Agoro. It was a fantastic discussion with you today. Please learn more about dyslexia. 1 in 5 individuals is on the dyslexic spectrum. That means for all of us, there's someone in our family, in our classroom, in our workplace, one of our friends, somebody we know is on the dyslexic spectrum. Or you. Absolutely, or you. So do learn about the science of dyslexia. We currently have a promo going on, a Valentine's promo for the whole of February. We have some great discounts going on for our online course, Understanding Dyslexia. Go and learn it at www.courses.dyslexianigeria.com. Take advantage of the Valentine's promo because we do love you and because we want you to love dyslexia. We've given that promo. So please go on and learn about it. And Dr. Ronke Agoro has been wonderful. Thank you for your time. Thank you for everything. Thank you for advocating for dyslexia. Your children are absolutely lucky to have you as their mom. And we are all have you as someone that we can look up to as a successful individual with dyslexia in Nigeria. So thank you so very much.
Thank you. Thank you very much, Lydia, for having me. It was my pleasure. And I'm glad to speak about it because it's my real life, really. So thank you.
Thank you very much. Take care, everyone. Have a wonderful weekend ahead. And we'll see you again next week. Thank you. Bye-bye.
Thank you. Bye.